Lotta Carlsson wird uns einen Vortrag halten zum Thema Sucht und Radikalisierung. Und dieser Vortrag wird auf Englisch stattfinden. Ich hoffe, das versteht ihr alle, denn wir haben dafür keine Simultanübersetzung. Dann danke ich und übergebe das. I give you, let you speak. Thank you very much.
Thank you. This is really a good way to continue on Dr. Carlsson's excellent topic there, because I work as an exit worker. So I sit down with these people we just discussed and do all kinds of work with them. And no, thank you. I think this is good. Thank you. I'm also a psychotherapist, so that means there's some insights to different phenomena. But today, I will specifically talk about radicalization and dependence. A limit topic right now. There's a whole full of spectrum of others when it comes to this broader discussion that was just taking place. And the last question there, what can you do with people overwhelmed? So let's continue a little bit from there, but with a focus on dependence. First of all, I come from an organization, the Diakonis Foundation in Helsinki, Finland, and it's a really old organization. It's 155 years old. Even before Finland existed, the foundation existed. So it's old, yes. We have almost 3,000 workers and do a lot of different work in the field of vulnerable persons, all of the fields actually. And at that foundation, we also have a Center for Psychotraumatology, where I originally come from and then was recruited into exit work. And exit work in this case means having all sorts of help or discussions or anything that extremely radicalized persons would need. So this is the third sector, exit work. In prisons in Finland, we also have exit workers doing quite much the same. And also the police has their exit work. So we started a project and really focus now on also an NGO doing exit work, because there's always this suspiciousness when it comes to officials and governmental institutions doing de-radicalization work. So we started a plan or a project, and we sort of thought, what's the Finnish exit model? How does it look like? And having a multi-agency team of 5 starting the work, we thought quite fast of taking quite a holistic approach to doing exit work. So that's where we are now, and we hopefully also have a second project starting soon. We do client work, we consult, we educate, and network extremely much. Yes, so that's probably one of the reasons I'm here today, but also because of my subject on dependence, I was asked by Radicalization Awareness Network to do an overview of substance use and violent extremism. And while we have practitioners being experts in the field, I was interviewing Mr. Kagerer on the topic as well in my overview. So, yes, we have the definition of dependence today is the craving of addictive substance or behavior. So, and there's a few examples. So we are talking specifically about certain topics today and not the whole variety of dependence. There's a lot. We could do a whole day workshop on the topic itself. But I would like to use Dr. Gabor Mate's famous words when it comes to addiction.
Psychosis, including HIV, including hepatitis C, cancers, they die of overdoses. This is trench warfare, and the people that are the frontline soldiers dying from it are the people affected by addiction. So that's where I worked for 12 years. And what I learned could be summed up really very briefly by saying that addiction is not a choice that anybody makes, it's not a moral failure, it's not an ethical lapse, it's not a weakness of character, it's not a failure of will. It's just how our society depicts addiction. Nor is it an inherited brain disease, which is how the medical tendency is to see it. What it actually is, it's a response to human suffering. And all these people that I worked with had been severely traumatized as children. All the women had been sexually abused. All the men had been traumatized, some of them sexually, physically, emotionally neglected. And not only is that my perspective, it's also what the scientific and research literature shows. So addiction then is actually, rather than being a disease as such or a human choice, it actually is, it's an attempt to escape suffering temporarily. By the time I went to work there, I had already been in family practice for 20 years. I'd seen a lot.
Okay. Just to summarize a little bit why we skip the more cognitive levels and go into feelings, as was discussed earlier, and also different reactions. Then we have violent extremism. What is that? It's kind of a hard word, and it might be hard to grab for someone who is not actively every day in their life working with extreme ideologists or in any other way. So it's those refer to using violence, threatening with it or encouraging it or justifying it on the bias of one's own view of the world on ideological grounds. So it may lead to individuals joining violent extremist groups or engaging in such action. At its most extreme, violent radicalization can result in terrorist acts. And as we know, there's no single pathway. There's always different things affecting someone to radicalize and even radicalize into violence. So what we do and what we heard here earlier on, exit work is quite much working with people's values and people's, when you work as an exit worker, you constantly have to have the stamina working with persons that has totally different values than your own. So we also need to emphasize on good clinical supervision, because it's sometimes one of the hardest works. And exit work is also, can be quite unboundaried, because people can contact late hours and so on. So there needs to be a lot of boundaries also in the work, because it's not like an education that you can do at the university. We have exit workers with all different backgrounds and all different frames of work, so to say. So the overview considering addiction that I did was to examine the ways in which drugs and alcohol form a part of wider social practices of different extremist groups and phenomena, and how drugs can be utilized for recruitment or radicalization purposes, and specifically how drugs are used to lower the threshold for committing extremist violence and or terrorism. So what I found was that rather than focusing on exclusive relationship between substance use and extremism, researchers tend to look at individual life circumstances. And risk factors and vulnerabilities in this context, considering substance use as just one of several vulnerability indicators. There's a lot of different push and pull factors, but while social drug use in extremist scenes, it tends to be quite a focus there, and the existing research suggests that drug and substance use can play a significant role in extremist social scenes, especially due to their link to violence. And people with a substance use disorder tend to be in a vulnerable state and therefore potentially more susceptible to joining violent extremist groups. We might think as this of course, this is the situation, but we also need to think of that there's not just one thing. When you radicalize, there's a whole biosocial scene. So keeping that in mind all the time. And substance use and addiction may sustain that vulnerability and thereby keeping the individual in the extremist group. And they are proactively recruiting not only among people who are addicted to substances, but also among those struggling with addiction more broadly. There was a good example of recruitment there that Mr. Kagerer was telling me of how someone already a little bit outside of the society was recruited into a group, not knowing for a year that there was a recruitment process going on, but still suddenly found himself in actively working in a group of radicalized persons. And the recruitment takes place in spaces where alcohol is consumed or where drugs and alcohol form an integral part of the social scene. Now we might think mostly of hooligans and other violent right-wing extremist scenes, but there is also violent Islamist extremism scenes where there's drugs and alcohol involved. So mostly young men with lower levels of education and a negative outlook on their economic circumstances are attracted to violent right-wing extremism, might also have a long history of alcohol and substance use, as well as involvement in criminality. This experience also seems to be echoed by experiences in the United States, where we had 72% of 44 former members of a violent white extremist group reported having alcohol and or illegal drug dependence prior to their radicalization. So the relationship between substance use and violent Islamist extremism is more complicated because of the religious ban on consumption and surrounding stigma. But then again, the ideology, as we heard earlier this morning, is not only the reason that people become radicalized. Rather, for many vulnerable people, social relations within the extremist group are the key factor. So social acceptance is much more important than ideology. And as we see, there has been done many attacks from the violent Islamist extremism, terrorism attack that was going on quite much in Europe, that there was consumption before the attack. So these attacks that were reported these 5 represented about 7% of the total of 75 perpetrators of jihadist attacks. So even though there's the stigma and maybe the religion banning, there is substance use among violent Islamist extremism as well. And then research on Daesh recruitment found that among local male recruits in Iraq and Syria, poverty was the predominant factor, whereas among European recruits, the main vulnerability indicator was a history of substance use. So fighters in Syria and Iraq used drugs because of belief that it would improve military performance and their bravery during combat. And you can hear these stories when working with clients violently radicalized, telling them going into combat and using, as was mentioned yesterday, Captagon, very common, and how to be able to just dump the feelings and be able to perform. So Lewis Harrington has analyzed the background of 52 men who had carried out suicide terrorist attacks between 12 and 17, and he observed that 75% of them had a history of chronic substance use. So it's quite much more common than we might think in the first place, which leads us to Dr. Gabor Mate's conclusion there that there's not always like this extremely severe trauma that needs to be extreme abuse or extreme circumstances. You can be traumatized in many different ways as well. And then there's the use of violence and the use of drug and alcohol to lower the threshold for violence is well reported in many other different studies as well, and in other different contexts. So drug and alcohol consumption has been shown to increase violent acts in situations of armed conflict, both in violent right-wing extremism and in violent Islamist extremism. And public violence, intimate partner violence, and also the foreign terrorist fighters in the northern Syrian camps. I would say working with foreign terrorist fighters, you can always see the generational trauma. Children in the camps, they used to be adults in the way that being 13, 14, you already are allowed to get married. and then returning back to Europe, or coming to Europe for the first time in your life, you need to be a child again. So, because of our rules and laws. So there's trials going on now that the females that had their children married at an early age are charged for human trafficking. So the children were used to a life of also consumption of alcohol, drugs, and now suddenly it's totally forbidden. So there's always these conflicts moving from the camps and back to Europe. And memberships in an extremist group is highly stressful, because there's almost always violence in the group as well as outside the group. If not physical, then psychological violence. And by having this toxic stress, it again increases the vulnerability and risk for substance use. And we can also see the, even without substance use, you can see the withdrawal symptoms of a person who has been in a gang or a violent extremist group when they exit. There's always the loneliness, there's always the same phenomena as when leaving substances behind. And radicalizing towards violent extremism is, in other words, harmful and healing simultaneously. So you have the cognitive dissonance of being in a group that gives you food, gives you shelter, gives you connection. And then at the same time, having the harmful environment, the toxic, dangerous environment. And this usually leads to the cognitive dissonance inside of yourself. Should I stay or should I go? And just an example of phenomenons, Stockholm Syndrome is a theorized condition. It's a theory in which hostages develop a psychological bond within their captors during captivity. So this comes from Stockholm in the 70s, where there was a bank robbery, and while the hostages was kept in the bank, they started to sympathize with the perpetrators. This can also be seen and heard in my discussions with clients leaving extremist groups. There's always amount of fear for, even if you left the group, there's the fear of maybe being listened to, heard to. For some reason, someone might find out that I left the group and I feel good about it. So there's always this ambivalence of being there or not. And this can be, so a group can be really addictive as well. We can think of this to keep it very close to us, because this is a phenomenon that can sort of happen to almost anyone, even how neurotypical you would be. So you can think a little bit about your own in-group, your own out-group. Somebody is maybe doing sports activities or have another group in their private life or at work, and maybe having a favorite view of their own in-groups and out-groups. So this is not a phenomenon that would be them, it can be us as well. And under certain conditions, substance use may be a cause of radicalization or a consequence, or even both. So this was in the workshop yesterday afternoon we had the discussions around this, like what's a cause and what's a consequence, and came to the same conclusion there as well. Of course, you can be addicted to violence as well. The rush, I hear it often, somebody discussing violence, the rush of going with my group and looking for a victim, and the rush and all the feeling of what's going to happen. So this is highly addictive as well, and even if you cognitively know that you're making wrong decisions, the feelings are the ones that rules, that we heard earlier in the presentation. So then we need to work on the dysregulation and the impulse control. So people give quite much of a prevalence when you discuss with them what is going to be the work. And we have to remember the comorbidity. There's multiple different things always involved. It's not as so straight as we might think or discuss. But then there's also the research more and more comes to the conclusion that intellectual reflection is neither necessary or required to become ideologically radicalized. So this is one of the most common misconceptions regarding this process. You can be fully committed and convinced as a violent extremism, even without ever having to show any interest in the theoretical background. So why do hate crimes become so popular? There's the feelings ruling. And research suggests also that reasoning is a means to socially justify choices, as we heard here earlier today, that you need reasons, you need something to socially justify the choices and behaviors that results from underlying emotions. And therefore, reasoning comes after emotions. So, challenging ideology without addressing the underlying emotions is likely to be futile, almost pointless, or lead to short-term changes. So it's good to keep in mind. And then when it comes to feelings work, there's a lot. We can take a few examples, but when it comes to feelings work, if you would, for example, now turn a little bit inside and take a look what 3 feelings you might feel at this moment. Just for a while, just reflect by yourself. You might quite fast come up with 3, but come to think of, there's over 100 different emotions, and we usually feel about 10 during the day, or recognize 10 during the day. So you need to really work on the emotional literacy to be able to reflect on yourself, to lessen the black and white thinking, and maybe also the arousal that was discussed in the last question. What should you do with these feelings of overwhelmness? So we're down to feelings when de-radicalization is a topic. There's also functional symptoms, back in the old days called psychosomatics. I think it's quite much of a better explaining word than functional symptoms, because there's extreme fear usually involved. It's the ruling thought that there's a danger, there's something I need to protect myself against, because usually of some underlying issues that might be trauma. You have the feeling of that I need to protect myself from something. And when you have this fear ruling, you might also have the interoception a little bit on the edge there. You might even be scared of your heart beating, and especially if your heart is beating a little bit faster. You might be scared of your digestive system working. Everything inside you becomes fear. So, and it's really hard to separate feelings from other things happening inside you if you're scared or if you feel that there's a threat. So everything inside you becomes quite fearful, and you develop different kind of psychosomatic symptoms as well. And also you become really scared of your own feelings usually, because there's unpleasant feelings and you really don't want to feel those unpleasant feelings, so you can usually shut them totally out of your system. So you have the splitting of your mind, and also different kinds of, we also think of external things as the trauma, but the trauma is the thing that happens inside of you, not the external thing. The external thing is the overwhelming, and you live in the overwhelm. And not to go into the society at this moment, but in general also. So we're down to feelings work in the de-radicalization process. It comes before the whole frame of ideology. So other phenomena, I can see a lot of learned helplessness in foreign terrorist fighters. And there's situations where, and now I really want to point out that I'm not generalizing. There's nothing of naivety here or anything like this that I would somehow not see also. I'm also actually a investigator of war crimes, so there's also this side of me. So but when you work with de-radicalization of a person, the feelings are always there almost first. If you're not a psychopath and don't really involve yourself in feelings in any way. But when it comes to many radicalized persons, it's phenomenons, it's situations, and it's the whole biosocial person. So the learned helplessness, and also things that might have been done when you're nowadays called a criminalized survivor, and not a battered person syndrome anymore. When you do things because of your psychological state, you might do actions of violence because you're suppressed in ways or another. This is what you can see when a female might have killed her husband after many years of physical and mental abuse. And this is also seen in the violent extremism scene. And also, if you hear somebody talking in a way of depersonalization, like the outer, there's me, I'm sort of, I can see myself in a, like I saw myself in a film. It wasn't really me. I saw myself in a film doing all this. And because he said I should have, and the group's pressure was there as well. So you can see the depersonalization of oneself and the splitting of the mind here as well. Just to bring you a little bit into phenomenons and different kind of mindsets of a radicalized person. So what do you do when you work as a practitioner? It would be good, actually in any setting, to make sure that there's some amount of trauma-informed approaches. This is now a boom in prisons. This is a boom in policing work. This is a boom in many settings where there hasn't really been a thought of that if you have a person, a violent person, that if you work on the safety, you might get more rehab out of the person in the whole setting, outside of the person and inside of the person. So now when there was the last prisons meeting internationally, almost all presentations included some views of trauma-informed working. So what does that mean? It means safety, first and foremost, because there's a lot, of course, in different settings, wherever, depending on where you work, there might be less or more safety for a person. And also trustworthiness and transparency. I had one client that I needed to really talk to the security police about one thing. And I first met her and discussed the issue with her, and then said that I have to do a discussion with the security police here. And she got really, really mad at me, of course. But while I had worked on number one, safety and trust so much, I knew she wouldn't stop working with me even if she got mad. So she trusted me so much already that she dared to become mad at me, knowing that I won't leave her even if she's mad at me. So took 2 months for her to get over that, but still I knew that if I want to work long term, I need to be transparent with her. So I would emphasize that if you need to discuss the network with a radicalized person, it's good to be really transparent there. Peer support. Usually when it comes to radicalized and peer support, there might be a repetition of shared trauma. So people meet and start to discuss the shared trauma or the shared traumatic events. So you need to think if it's good or bad, is this what persons need at this moment? Also collaboration and mutuality, which means self-regulation, not only the clients, you also need to regulate yourself in many different ways. I thought of us regulating us today by just, for example, feeling the chair against your back, feeling the chair against your bottom, feeling your feet under, or feeling the ground under your feet. So you regulate yourself constantly working with very dysregulated persons. You need to be in a state of two-minded state where you constantly know where you are, how you feel, so you don't drain yourself with the conspiracy theories of, for example, where is the pigeon babies? Have anyone ever seen the pigeon babies? Yeah. There's a lot of conspiracies going around. So you need to ground yourself. You need to feel your body and know where you are when you work with radicalized persons. And also all people needs to be heard, seen and heard. And I think that's one of the most de-radicalization cards we have in our pocket, to be seen and heard. There was some mention of not being understood. Why is nobody getting this? When it was a discussion of stupidity there. So as soon as somebody reach out and say, I can see you, I can hear you, and I see your problem, let's discuss this. There's immediately a decrease for most people, not all, but for most. There's some cases that are lost, it's in all fields, and that we have to live with. But also a sensitivity of cultural, historical, gender issues. There was some discussion of traumatization. Yes, there was a good example yesterday when we were discussing PTSD of women and male reacting differently to trauma, and how some might choose the fight reaction while other might choose the flight reaction, and then in their trauma reactions have different ways of coping with hard happenings. So now also the trend works more and more with paying a greater attention to protective factors, and it offers somehow more opportunities for more effective case management, including the rapport, as was discussed. It takes time because there's always a lack of trust. There's a hypervigilance to threat. We can see if a person is quite traumatized, quite in a state of that there must be an enemy out there. There's also usually an amount of hypo or hypermentalization, which means that we can hear people saying, I know what you're thinking. I know you think like this. And so the frame is that there need to be a hypermentalization. I need to have a frame of what you are thinking, and then it's more safer for me. So as soon as we hear this as workers, we can also challenge this a little bit and sort of make the mind a little bit more flexible and not so black and white that usually happens when there is a fear out there. Also, hypo-mentalization might happen. There is no possibility to discussion, there's no listening, there's no reflecting back on what's heard. There's just the danger around you and the enemy that you have to fight somehow. So also to start having discussions more in the direction of challenging when possible. For example, like my client was mentioning now when Finland is joining NATO, and that's quite a unclear fear for many radicalized persons, and immediately told me, like, we can't join NATO. I will never give my tax money to NATO. And I inflicted like, but you're unemployed. And so you challenge the mind a little bit and make it more flexible in many different ways when it's this black and white. And also the motivation. So we need to go beyond cognitions and use emotion and dare to lead our radicalized persons in to going towards the pain and follow the pain, especially if there's drugs and alcohol involved. That has been the sort of relief and the temporary relief of not having to feel the painful feelings. Slowly but surely, one thing at the time, one step at the time. We're also, that's what I'm always thinking about when it comes to our foreign terrorist fighters in Europe at the whole, when every day is sort of a victory, because every day there's more emotional intelligence, there's more reflection, there's more other thoughts in the mind that might, even if there is a traumatic experience in the past, the mind is getting more and more flexible to work with. And it's sort of hard to return to scenes of violent Islamist extremism if your child comes home from school, even a child that has returned from Al-Hol and comes home from school and says like, oh, mommy, I did these great things, and you know, I learned this and this. So mommy is also learning that there's a lot of different views, a lot of different reflections done. Even if it's not us de-radicalizing anyone, it's the society also at a whole. And also, of course, better support for intervention planning, and we need to help the helpers. This is really important because having work with clients, if you take a client with substance use, they go in and out in the process. So it's not like a linear de-radicalization phase. I have one guy who is on and off on cocaine, and he's just suddenly appearing, and we work for maybe a month, 2 months, and then he disappears for a month, going off somewhere, doing whatever, but he still at some point contacts me. So it's good to think of exit work or de-radicalization work when it comes to addicts, that you never sign the client off, because different events in your life will always lead to the triggering of some new events, and then you have maybe some time of work with clients. And then they might disappear and turn up again. So having sort of a multiple work is also great. If you have a chance to work with, for example, a substance counselor or somebody really into substance use at the same time. So it doesn't mean that you cannot work as a exit worker while there's other also working with the client. And I would stress help the helpers. It's really important. And we need to have like a comprehensive consideration of the person's history, and also if there's treatment options that needs to be discussed, and also have the whole multi-agency team working, because there's usually police involved, there's usually maybe probation officers involved, social workers involved, maybe childcare is involved, and if not having multi-agency teams, we don't know what's happening. This is very well done in many countries. Other countries not so well done, but getting there. So there's differences, but I think it's really of importance, because we remember the traumatized mind of splitting. So you can see this, that there's a huge victimization for some workers, and then other workers might not be in a position that it awakens the victimization, but maybe more of different state. So when you collect everyone to a multi-agency meeting, you also collect the client's mind to not split into different directions. And yes, of course, when it's addiction and substance use involved, it's usually a longer process. It's not linear, it's not as maybe effective or fast as some other processes, but it's still a process. And of course, in prisons, there's a lot of substances, so you also need to consider at what point you work with what. And also then it becomes a challenge to carry out effective risk assessments. When it comes to incels, involuntary celibate that does violent acts or extremist acts with violence. Mr. Van Brunt has written an excellent book on incels, and where he have been working with incels, usually radicalized alone at home in front of the computer, and then starts to work with this identifying and managing the daily frustrations and slight experiences by the incel requires him to first identify how his body is experiencing these biological changes as he becomes increasingly upset and frustrated. So not to go into so much of incels themselves and what the ideologic thought there is, but also to work with incels that might is doing some sort of a violent extremist attack and still being seen as a lone actor and having the whole network in his computer with he can be a huge leader in his network at the computer, even though he's never seen any one of these persons. So there's also the toxic masculinity discussed in this context, but I don't think we have time or will not go so deep into that. But when discussing incels, there's a good thing to think of how to work with inside experiences as well. So what's the challenges when it comes to substance use or addictions in general? There's so many pathways to radicalization, there's many, and there may be limited or no availability of appropriate care. So all radicalized people or radicalized into violence do not have access to health care. So then we also need to work around this. For example, asylum seekers. We had a terror act in Finland, 15, if I remember right. A young Moroccan guy who was an asylum seeker killed a few persons, and he was then an asylum seeker. So he was, prior to the terrorist attack, asking for help multiple times, many times, and was always told, because of your status as an asylum seeker, you don't have right to health care. So, which led to a radicalized act. And when it comes to substance use and other mental health disorders, it might slow down the process of de-radicalization or integrating back to society. And yes, trauma might be present, and another challenge for practitioner carrying out exit work. What we have learned so far is that we need to develop and adopt a comprehensive multi-agency strategy for preventing and countering violent extremism. We need to involve mental health practitioners in interventions. And of course, thinking of police exit work, thinking of prison exit work, it might not always be so easy because of secretaries and other things. We need what can be told, what not can be told. Always when you work with security police, there's this amount of them usually having a lot of information that cannot be shared. But they insist on us working with the client because they have information, so they know it's good to work with the client. And we might sit for a long time with the client and not really find the reason for our work, because there's something we don't know and something that the person is not telling us, but still we keep on doing the work, and when the trust is gained, there might be also discussions of what the police was thinking of wanting us to work with the person. And we need to continuously monitor and evaluate PCBE programs. This is highly important as well, and that's where RAN comes in as an extremely good motivator for this. I think they sort of set the scene in Europe and does constantly evaluate programs, because many countries might think that the standardized evaluations that are existing might not be good for their country or something, and then they develop own, which are not sort of validated instruments. And then you might have 5 different workers working in 5 different ways and evaluating in 5 different ways, and no sort of quality or standardized programs. And also CSOs are good to involve if there's a problem with an addiction, or somehow you need to have specific knowledge from some different addictive behaviors. So there's a large field usually of CSOs who has that information and then work simultaneously with these persons. And of course, carry out further research on substance use, addiction, and radicalization. I don't know the time, but...
Yeah, we maybe should come to an end.
Okay, just a few lessons. So it's also good to involve community. It's also good to involve families, the whole network around the person addicted to something. Make greater efforts to understand these culturally specific treatment options. We have our ghosts, and in the Arabic culture, they have their jiddis and jinnas. And if we don't understand this phenomenon, how much a jiddi can affect a person, then it's quite hard to de-radicalize or work with someone who we don't really know the cultural aspects, or maybe not be interested in cultural aspects, because in all our cultures we have these phenomena and beliefs, a lot of beliefs. And also ensure that non-mental health professionals receive training and understanding the impact of addiction, and establish supervision programs with case studies to allow practitioners to share best practice. This is something that RAN also does a lot. We meet all over Europe to discuss different clients and get a multi-agency approach to client work. It's really effective and highly suggested. A little bit of last context. Patrick Myers has written of the female returnees, and Kerstin Schiska has sort of made an overview of that. And when the client's going between different polarized states, for mothers like Sunia, returning is very difficult in a battle against feeling of destruction, with every small step towards ambivalence and integration being impeded by shame, self-reproach, and anger. It is these cases that illustrates just how difficult the path to reintegration can be. So working on the shame, you integrate. Thank you.
Lotta, thank you very much. Don't run away just yet. Thank you very much. Ja, gibt es Fragen nach diesem doch sehr interessanten Vortrag?
Exactly.
But there's so many things, so many interesting things that you talked about, and I see myself doing certain things that you mentioned there. But it's not a one question or one of this, one of that. But if we could have another opportunity to discuss, it's a very, very interesting subject that you mentioned. Thank you.
Thank you.
Thank you so much. It's a real question. I have no idea about the answer. Are there in Syria or Iraq, are there also persons who are not supporting the system, making an exit work with fighters or radicalized?
De-radicalization.
Yes.
Yeah.
Yeah, there are people on ground as well, working with people in Syria and Iraq. Yeah.
Can I ask one more question? And you are working together, or how the network you mentioned, the international network you mentioned, are the Syrian or Iraqi exit worker with you in your international networking?
Also, yeah. Yeah.
Thank you very much.
Mostly European, but they might be of Syrian or Iraqi origin.